All right, I think we are good. Thanks again for joining. If we haven't met yet, my name is Zach Donnelly. I'm Representative David's Communications Director. I will be sending out a press release afterwards with a recording of the presser. So for some reason your recording isn't working and you're busy taking notes, we'll make sure to get that to you afterwards. And then after we get through this, we'll have some time for some Q&A. But I think we are good to turn it over to Rep. David. So take it away.
Thanks, Zach. Good afternoon, everyone, and thank you all for joining us today. My name is Sharice Davids, and I represent Kansas's 3rd District in Congress. And I just want to start off by recognizing the Kansans who are on here with us today. Nancy and Stephanie, thank you for joining us to share your stories. And then Justin, our partners at El Centro, appreciate you guys. You know, your voices are certainly going to remind us of why we keep fighting for affordable health care for every single family in Kansas. I'm not going to take too much of Nancy's story, but her premiums are set to almost quadruple next year. Stephanie's premiums are going to go from $20 to over $600. And I just want to make sure that everyone recognizes that these aren't just numbers, that these are devastating numbers, but this is families facing impossible choices between paying for healthcare and paying for groceries and rent and medicine. And, this is why we're here today, because the affordable care tax credits have been this lifeline for millions of Americans, including 160,000 Kansans who have saved around $700 last year. And this has helped keep coverage affordable and has made a real difference in people's lives. But these tax credits are set to expire at the end of the year unless Congress acts. And even though open enrollment has already begun, Congress still has a window to extend these tax credits and prevent or at least reduce the steep premium increases that are expected for folks in 2026. This fight is not about political parties. This is about people. Families should not have to pay more simply because lawmakers cannot figure out how to come together, which is why I've been calling on members from both parties to work together to extend these tax credits. And, we have seen an appetite, even from the president, to make that happen. Action Now can provide stability to families, to seniors, and to small businesses in Kansas. And it also sends a strong signal to insurers that coverage is going to remain accessible for folks. So I want to, before I turn this over, I want to emphasize the importance of open enrollment. Even as we work on this fight to extend the tax credits, the reality is that prices are going up and that families should absolutely compare plans carefully, should take advantage of any assistance that's available. And then organizations like El Centro are helping people navigate these choices. And it's one of the things that I'm so grateful to El Centro for is that work. The bottom line is this, that we do still have a chance to act. Congress can step in. Congress can extend these tax credits. Congress can help prevent a healthcare crisis for working families. But the clock is ticking. And this is the moment that we need to come together, that we need to work across the aisle, and that we need to be putting the people that we serve over politics. And I'll just say one more time, thank you to Nancy and Stephanie and Justin for taking the time to be here, for sharing your stories and your work. Your experiences that you're going to share are going to put a human face on this urgent need for Congress to act. And I'm just really proud to get the chance to join you today as we continue to push and fight for this. So I'm going to keep working to make sure that no Kansan has to choose between paying for health care and putting food on the table, and that, we can act now and we must. So I'm going to turn it over to Nancy Mays to share a bit about how these tax credits have helped her family and then what it's going to mean for them to expire. Nancy?
Sure. Thank you so much for having us, Representative Davis. I'm really grateful to share our story. So my name is Nancy Mays, and I live in Mission Woods, Kansas. And the ACA tax credits allowed me to start my own business, which is something I had always wanted to do. And, without the coverage, insurance coverage from my full-time jobs, which I had always had, I couldn't do it. And so the tax credits made that absolutely possible. And we have been so grateful for that. And it has worked, well for our family. And the business has grown. And it's also just been amazing to see what I really wanted to do come to life. It's allowed us to afford, everything, doctor's visits, prescriptions, preventative care, without going into debt at all. And so with them set to expire, we knew that was coming and we knew the premiums were expected to go up. So we were not happy about it, but we knew that that would happen. But we were very shocked to learn that our premiums are quadrupling. And just for my husband and I, our insurance, which is, we don't have like the gold standard, but it will cost over $2,000 a month for the two of us for very standard insurance. And an increase like that is something you really have to think about, right? Can I keep doing what I'm doing? Do we need to do something else? And then it's going to make all kinds of families, not just ours, but make really hard choices about what we want to do. And I just feel strongly that affordable healthcare, it shouldn't be a luxury. It should be a right for every Kansan. So, I mean, I'm calling every day my electeds and asking them to please extend these ACA tax credits so that families like mine and others can keep their insurance and healthcare costs, manageable.
Thank you for sharing, Nancy. My name is Justin Gust, and I'm the Vice President of Community Engagement here at El Centro. We're a welcoming center for Latino immigrants and families, and have an office in downtown Olathe to serve Johnson County. And we also have what we call navigators, who are people that are able to help with the enrollments into the marketplace, which we saw started taking appointments yesterday. We've served probably about 10 individuals so far with their enrollment efforts. And the reason why this is important to us is because we have seen how the marketplace has allowed people to gain coverage to healthcare, and especially our clients that don't necessarily have traditional full-time jobs. A lot of our clients are working either multiple jobs or doing contracted work. They're self-employed, or they're starting their own business, like Nancy mentioned. And this marketplace option gives people the option to affordable healthcare coverage. And so we've seen over the years and participating and helping people enroll year after year, how that has really impacted their lives, not just in terms of access to healthcare, but to lead a healthier life, to be able to go to the doctor and get those things taken care of that they need to, so that way they can be present with their family, that way they can be present at their job and be able to continue to work. And so we've seen the very positive side of the marketplace. We also know it's a confusing process. It's not shopping for insurance, whether at your job or in the private market, is not an easy task. And there's a lot of terminology, and especially for folks that may not have had health insurance before, it's a very new thing to learn and can be difficult to understand. So part of our navigators' jobs are to also walk people through that process of learning what is a deductible, what is your maximum out of pocket, how does this all work when it comes to actually going to the doctor and receiving your bills. In addition, we're able to provide a lot of people with other resources and programs that we have here at El Centro, aside from marketplace enrollment. With the enrollment so far this year, what we've seen way higher prices, even for those that fall in a special category to where they're in a silver plan and their premiums aren't as high, because of the cost sharing. Even those plans we've seen jump. One person from paying $20 a month now has to pay $120 a month. We had another family that has family coverage through the marketplace, and they're expected to pay an additional $500 a month. I don't know about you, but I have not gotten a $500 a month raise recently in the last year. And I imagine a lot of other Kansans are in the same boat, that they don't. it's kind of like this inflated price, which is harder to do. The other issue that we're seeing too are some of the plans now have higher deductibles. I have one person whose son was enrolled into the marketplace coverage, and her plan it hasn't gone up a whole lot. It's about $75 or more a month. But the biggest difference was in the deductible with the same plan level as last year. Last year, her deductible was only $2,000. Now it's spiked to $10,000. And that's with the same plan, the same insurance company. So we know this time is going to be very confusing for folks. And so just putting that message of it's open enrollment, we are here to help and help people kind of navigate this process. We call on Congress to extend these tax credits because we know the difference it makes in people's lives. And if people just need more information, to feel free to contact us. If we're busy, we'll also connect you with other organizations in the area that are doing this work as well. I'll pass it over to Stephanie.
Hi, thank you, Justin, and thanks for having me today. My name is Stephanie Barr, and I live in Prairie Village. I am a going on 15-year cancer survivor. When I was 30 years old, I was diagnosed with breast cancer. I was uninsured, and I was working as a waitress. I was living in Salina, Kansas at the time. Fortunately for me, being uninsured, I was able to get on Medicaid. That got me through my initial treatments. And I did surgery, chemotherapy, radiation. The years went on. I didn't have insurance, but I was working. I was healthy. Went back to school, moved up here to Johnson County, went to Johnson County Community College and began a career in the service industry as a manager. And then I was able to I didn't have insurance and I was working full time. I lost my mom to lung cancer. I was going through a rough time in my life. And then the Affordable Care Act allowed me to get insurance through the marketplace. And so I've been using the marketplace for several years now. 2 years ago, because of the radiation that I had done to my body, my skin was damaged, and somehow I ended up getting a staph infection, which caused an open wound. And thankfully to my healthcare marketplace plan, I was able to go to the hospital. I had a hospital stay, antibiotics, as a whole nother health crisis. And so for the last 2 years, I've been doing treatments, and I still have an open wound. And I go see my wound care doctor every week. I had a wound vac. I've had to do oxygen therapy. And I am so close to having this wound healed at this point. But I am also now at a risk of losing my health insurance, because my health insurance is set to go from $21.70 a month to well over $600, $646 a month, if I lose those tax credits. So I would not be able to renew my insurance in a time that is crucial for my healing, because I will not be able to continue to see my doctor every week. I'm still at a risk for infection, and I'm still not done with this journey. So yeah, my health insurance credits could be going skyrocketing. And so I will have to make that tough choice to not have insurance. I'm in the restaurant industry, where they cap you out. They don't allow you to get overtime, and they don't want you to work 40 hours so that they don't have to offer you benefits. So even if I were to pick up a second job in the restaurant industry, working two jobs, I still wouldn't be able to get any kind of benefits from either one. So unfortunately, that's not an option for me. So yeah, so I'm looking at a really tough place where those insurance credits are going to be very important for me. Yeah, I'm facing more surgeries and stuff coming up in the next year. So hopefully they'll be able to extend those credits so that I'll be able to continue with my treatments. And other than that, I'm afraid of what's going to happen.
Oh, Stephanie, thank you for sharing. I'm so sorry that that you even have to deal with any of this, the stress of this. And thank you for being willing to share your story with everybody. And Nancy and Justin, thank you guys as well for sharing your experiences and the work that you do, and helping people understand just how real and urgent this is for folks. You know, Stephanie shared a story that I think, unfortunately, too many too many people are going to be in the same situation. These stories are the reality for thousands of Kansans, premiums quadrupling, facing impossible choices, and then just the fear and anxiety, especially when you have things that you need to get done medically. And Congress has the ability to walk and chew gum at the same time. Like, we can get the government reopen, protect workers, and extend these ACA tax credits permanently. These are not competing priorities. In fact, this is all essential. These are essential things that we need to be doing for families and communities, not just across Kansas, but across our entire country. And, but bipartisanship is, in fact, the reality is that is the only way we're going to move forward on this. It's like we're way past the time of playing politics and worrying about politicians winning and losing, because this is about people's health care. This is about people's families and ability to take care of their families. And as folks have heard, open enrollment is underway, and as people have also heard, families are already feeling the impact. This is not something that can wait. We owe it to every single Kansan to do what we can in the Congress to make healthcare more affordable. And we have not just the power to do that, but the responsibility to get this done. So I'm going to continue to push for this. I'm going to continue to call on my colleagues to push for this. And again, thank you all for being here. And I'll open it up for questions. I think Zach will probably manage that process.
Yeah, great. Thank you, Rep. Davids. We now have some time for Q&A. If you do have a question, feel free to raise your hand and I can allow you the permission to talk. All right, Keith, go for it.
Hey, thanks, by the way, Nancy, Stephanie, and Justin, for sharing those experiences. Really impactful. But my question is for Representative Davids right now. Would you be willing to share where you stand on the idea of running for Senate?
Yeah, I mean, look, when I first ran for Congress, the whole reason I did that was because I wanted us to have a strong voice in the Congress that was going to be listening to the needs and issues and even the successes of folks at home. And right now it is unclear what's going to happen with the redistricting. I am focusing on trying to make sure that the Kansas legislature doesn't move forward on redistricting, because it is actually just bad for the state. Voters should be choosing their representatives and not the other way around. I'll just say that if they move forward with this, I haven't taken any options off the table about what I'll do next. I want to continue to do what I can to bring the voices and needs of Kansans to Congress.
Thank you, Rep. Davids. And let's keep the questions to the topic at hand today. If you do have something else, feel free to send me an email afterwards. But now we'll go to Morgan for healthcare question.
Hi, Representative Davids. I've heard a lot of different framing around why Congress hasn't been willing to go ahead and continue these subsidies. What is your assessment of why this hasn't happened so far, and whether you think it will happen?
I'm feeling cautiously optimistic about it happening. And when I say I'm cautiously optimistic, it really is just because I want to acknowledge that we are in a time where so many people are so stressed out and so and being pulled because costs just keep going up on everything from gas to groceries and healthcare. And what I have seen and what I have heard is at a minimum, we've seen a couple of proposals coming out of various groups out here in the Congress. And I think what we're starting to see is a recognition that Congress can walk and chew gum at the same time. And even hearing from some of my colleagues that I would not normally say I'm on the same page as, talking about the importance of getting the tax credits extended is you know, I think it's encouraging, and it's cause for us to look at this. You know, when you've got me and Margie Taylor Greene on the same page on a piece of policy, that tells me there's a reason to be cautiously optimistic. And so, you know, letting these credits expire would mean higher healthcare costs for thousands of families. And I don't think that this should ever be considered a political bargaining chip. I'm feeling cautiously optimistic that we're starting to see enough movement from both sides of the aisle on this.
All right. Well, thank you so much, everyone, for joining. Like I said, we'll send out a copy of this recording afterwards. But thank you, Nancy, Stephanie, and Justin as well. If you have any questions, reach out. But take care. Thanks again.